So how is gestational diabetes going to affect your pregnancy? So we know that with well-controlled gestational diabetes, whether it's with diet and exercise or medication, you can still have a healthy normal pregnancy and a normal birth. So we're here to help support you to monitor your diabetes throughout your pregnancy to help make this journey easier for you. So the most common effects with diabetes in pregnancy is the extra glucose that's going through to your baby can often make your baby's tummy a little bit larger, and sometimes the sugar can be deposited in baby's shoulders as well. So this is one of the reasons why we look at how your baby is growing. If we're not able to detect this when we're checking your baby when we're feeling abdominally. So we do like to check how things are going with a scan as well. So some things that can happen with gestational diabetes, you're more likely with baby getting a little bit bigger through the tummy and the shoulders. So we try and keep these sugars very well controlled to prevent this happening. Sometimes if the blood vessels aren't very happy because they've had a little bit of sugar going through them, sometimes the blood flow through can be a little bit less. So sometimes babies actually are small when you have diabetes in pregnancy. So we like you to maintain healthy eating and healthy nutrition and maintain those blood glucose levels to prevent these sort of things happening. We know that when babies are born a little bit earlier, they sometimes need help with breathing and keeping warm. So sometimes babies when they're born early need to go to the neonatal unit, and they can get yellowness in their skin, which is called jaundice. And also once your baby is born, if they've had lots of sugar coming through to your baby is at risk of having lower blood sugars because they've been used to that higher amount of sugar coming through. And for women, if their diabetes is quite uncontrolled and not monitored and managed, there is a risk for stillbirth. So we know that diabetes tends to run in families. Your baby will not have diabetes, but your baby has a family history as he or she grows up to have a risk for diabetes in pregnancy. And we know that breastfeeding your baby helps to reduce the risk of diabetes later in life. So we have Zoom classes available through ADHB that you can attend for help with breastfeeding. We like to keep mums and babies together still. We encourage skin to skin and bonding, keeping babies warm, early breastfeeding, and when you get closer towards your baby's due date, your diabetes midwife would talk about expressing colostrum, which is the breast milk at the very start of your breastfeeding, and it is before the milk comes. So colostrum can be expressed from about 36 weeks, and we keep it for your baby, and a midwife would go through this procedure with you, but it is very safe to collect a little bit of breast milk before the baby comes just by hand expressing and store it ready for your baby in case your baby needs it.